Hello and welcome, everyone. Happy New Year. Thank you for joining us today, and thank you to our friends at MANET for hosting today's session, The Power of Lifestyle Medicine to Prevent, Treat, and Reverse Disease with Dr. Elisabeth Fontaine. Dr. Fontaine practiced gynecology in a small community for 25 years, where she had tremendous exposure to a variety of patients and medical conditions. She also has a deep interest in helping her patients maintain or improve their health with a master's degree in obesity and exercise physiology. She is board certified in lifestyle medicine, and Dr. Fontaine was the medical director of lifestyle medicine in Rise VT, a community-based intervention to encourage healthy lifestyles. And we are very lucky to have her as a MAVEN Project volunteer. So Dr. Fontaine, when you are ready, please begin.
Well, thank you very much, Christine. This is such a pleasure to be here. And thank you for the MAVEN Project to allow me to give you this presentation. And like Christine said, Happy New Year. I think this was the best time to do this presentation at the very beginning of the year. People have a tendency to take new resolution. Don't know if it's good or bad, but anyway, this will give you the chance to potentially do some CME, and I will review that with you. I'm here to give you more of an overview of lifestyle medicine. I'm not going to go in any specific detail of treatment, but to give you an idea of what some of the evidence base and why it's so important to do the approach of lifestyle medicine. I've used a lot of the slides that were provided by the American College of Lifestyle Medicine, but I don't have any affiliation with them. So like Kristen said, first of all, I just want you to have as much curiosity as you can. This is a new field. Some of you are a little bit familiar, some of you it's totally new. So it is important because if you don't have curiosity, you can let your story, your old values of influencing and potentially being against new things. So just open your mind and let it flow. We'll go we'll see where we can go. So like Kristen said, first of all, my accent comes from Quebec, so I'm a Canadian. I was trained as an OBGYN in Quebec, and I came to a small community in Vermont, and I practiced here for many years as a general OBGYN. And because of my interest and background in obesity and exercise, I saw my patient getting unhealthy, send them to their primary care, nothing wrong with the primary care, but they were overwhelmed, often be on medication, and I knew that something could be done. So I start my own program. At the time, it was called Better You Program. I had very good result. I run many of these programs. And it's during that time that I discovered the American College of Lifestyle Medicine, and I went for the very first conference around 2010, and we were not that many there, but I was amazed of some of the results that I seen at that conference, mainly related to diet and plant-based diet. And I will show you some of these results. And it really changed my way of helping my patient, not only with the other element that you will see of lifestyle, but really helping them with changing the way they were eating, to the point that when I came back from that very first conference, I took 15 of my patients, including my family, which my husband thought that I was crazy, but for 21 days, I really submit them to a plant-based diet, did blood work prior to and after, and was able to demonstrate, like literature had demonstrated, some of the significant changes. So this was very interesting and really helped a lot of people to continue the lifestyle, and I became then the medical director of lifestyle medicine. And we also have in Vermont something that we call Rise Vermont that is all related to lifestyle, started in our small community, and then was seen as the primary prevention model. So for us, we were working on prevention of childhood obesity. So here is giving you a little bit of what, all right, so now I need help to change my slide, which doesn't appear so surely. I'm just clicking my, let me see if I can do it this way. There you go. I found it. So disclosure, I have none. So here's what we're going to be reviewing together. Some question, why lifestyle medicine? What is lifestyle? Why is it a good time to think about? And one thing I wanted to say, this is such a good time to think about lifestyle. Most of you are probably not aware that there was a conference in September regarding at the White House regarding hunger, nutrition, and health. These type of conference haven't been done for the last 20 years. So it's very interesting. Obviously, we're talking a lot about chronic disease, and the American College of Lifestyle Medicine was very involved to the extent that, and I will give you the information again at the end of our presentation, the American College of Lifestyle Medicine is investing $22 million in order to provide CME to healthcare provider. And that's 5.5 free CME that is provided to you for lifestyle medicine and food as medicine. So again, this is huge. They also provide 2.1 million to help physicians that are in the FQHC to become board certified. So another very important element for you guys. And I believe that in some of your organization, one individual could be interested to be a champion and become, like me, a board certified physician in lifestyle medicine and help the team. So I will repeat that. I will give you the information so that you can have access to all these amazing elements. So you're going to see also on the left, the slide is the Let's Lead, Be the Change. That's what I'm doing now. I'm coaching physician and healthcare executive in leadership and well-being. Also have help a practice in lifestyle medicine that does telehealth over United States. So just want to make sure I'm still doing a little bit of practice here. So why lifestyle medicine? I know it looks like a little funny, and that is true. Most of our patients are interested to see us so that we can have a quick fix. Medication, surgery, and the lifestyle change. I'm sure that you've tried. It's not easy. It's a lot of work, and we need to understand that it's not only for the individual, but we need to have an impact on the community, the system at large, in order to see changes. And the big thing, me that is coaching now, I realize that a lot of the burnout is not only due to the system, the culture, many hours of working, the EMR, but it is due also with the amount of chronic disease that our patient has. When I signed up to go in medicine, I didn't sign up to see so many people with chronic disease. Even as an obstetrician, gynecologist, I was surprised to see that much. I am hoping that eventually we'll be able to see patients that are healthy, and we want to keep them healthy. So I always like to start, kind of set the stage. On this slide, and this slide, even if it says 215, hasn't changed much. This is life expectancy versus healthcare expenditure. And you can see very easily that United States is not doing a whole lot better than many other countries that do not invest as much money in healthcare. Here we are, we're investing 4 times as much than any of these other countries. The important thing too to realize is that the spending represents 17% of our GPD, 17%, and most of this is related to chronic disease. And chronic disease, 80% and more of them are related to our lifestyle. They're not related to genetic, like we may think a lot of our patients are thinking, but really to our lifestyle. Here's another good example. On the left side, what makes us healthy. On the right side, what we spend on being on health. So what makes us healthy? 50% healthy behavior plus 20% environmental. So this is 70%. And when you look at the top, access to care, that's us, that's the healthcare provider, that's hospital, 10%. what makes us, what we spend on being healthy, we spend a very small amount. And what do we spend? A lot of money on hospital, healthcare, chronic disease, medication. So this hasn't changed much for the last 50 years. So it is important that we start thinking, not only the system, us as physicians need to be involved and make these changes happen. Again, another good example, those 8 risk factors drive 15 most chronic disease that you and I see. So the risk factor being the poor diet, that's what we see the most, physical inactivity, the smoking, stress, sleep. And it drives the most common disease that you guys are seeing, diabetes, coronary artery disease, hypertension, and that represent 80% of the total cost of the illness, not just in the United States, but worldwide. So that slide is a little bit fuzzy, but I wanted you to pay attention that most of the risk is actually coming from our dietary risk. And that is not just related, as you might be able to see later, is not just related to fast food. It is related most to the North American or American diet that often will include a lot more than in the past of meat, cheese, milk, eggs, all these products, unfortunately, drives quite a bit more the chronic disease that we may think. So obviously, all the other ones are important, but it's always surprising that the diet is the leading cause of all this. So 3% of Americans live a healthy lifestyle. So that was demonstrated with Mayo statistic. Not to review what I've discussed already, but regarding the exercise, this minimal exercise that we request is 150 minutes a week, which is not much, 3 minutes a day. You'd be surprised to see that most of your patients are not achieving at that level. And I used to have this as a vital signs in my electronic medical record to see how many of my patients and how much activity they were doing. Then again, the diet, when I'm going to review what score this represents, the percentage body fat, and obviously this is something we know also regarding not smoking. But the most important thing is to realize there's only 3% of Americans that lives a healthy lifestyle. So what is lifestyle medicine? And we'll review also some of the evidence-based intervention. So the definition may appear to be simple. Basically, a whole food, plant-dominant dietary lifestyle with the exercise. And you'll see with the next slide, I put them in order. Those are the pillar of lifestyle medicine. I will tell you, the first time I saw that, I said, well, anybody can do that. But it is not as simple. Lots of change needs to happen in order for a patient being able to achieve those changes, and again, community. And the best person really to help here is really you, the healthcare provider. I want to say that if you just check on PubMed, you'll be amazed that lifestyle medicine publication hits now over 60,000. So here's the pillar of lifestyle medicine. We put at the first, the nutrition, sleep, exercise, substance use, stress, and social connection. And by nutrition, again, I want to stress that it's not, obviously we encourage the whole plant-based diet, but I tend to tell my patient a plant-based diet, a forward plant-based diet, just to change a little bit of what they usually put on their plate and add more vegetables, and rice, beans. They have to, go through a little bit of a change, but actually you'll be surprised what's the result. And obviously being a little bit more active. So where do we fit with lifestyle medicine? I do realize that There's a lot of option that exists out there. I mean, preventive medicine, you know that, you have the health department with the vaccination, the prevention, and all the other like functional integrative. There's a lot of novel diagnoses with nutraceutical, and there's a blend, if you look at functional medicine, integrative medicine, and lifestyle, there's a blend of all this. But the lifestyle medicine, if you pay attention at the bottom, it's really first the root cause of the problem, which is most likely related to our lifestyle. So it is there for prevention, treatment, and remission of chronic disease. This is such a nice example of where lifestyle medicine fit. It's right in the middle. We can assist in many orientation and many specialty, primary care, including internal medicine, family practice, but also pediatrics and OBGYN in specialty. And also, if you look on the left, the science that has moved and changed drastically within the last few years, including the gut microbiome. It's amazing how much impact our gut has an influence, and that the North American diet is not totally helpful when it comes to this. Aging, the epigenetic also is really important. So there's a lot of studies that are done. And when you look all around, the social determinant of health are there and have this, kind of liaison of all this, which goes with the community-based intervention, which is very important in all the aspect of the lifestyle medicine. Also in the quadruple aim, and I think that for us, we know how important it is to have these first three, but for us also, the lifestyle medicine is the foundation of population health and value-based. That's what I was transmitting for message in my own organization. And the last one, this better clinician satisfaction, for me is huge. People, physician would feel much better if we had the chance to improve their health, as opposed to simply give a pill, which eventually become a burden to even have them taking their medication. So I'm going to review some of the evidence base in lifestyle medicine. Obviously, it is hard in a short period of time to review all the literature, but I want to review some of the pioneer that had made, allow lifestyle medicine to be on the planet, I should say, and some of the community-based interventions. So I'm hoping that that will give a little bit of an idea. Also, I have a short video. So the first, probably the one example that you're fully aware, and you probably use that program, the diabetes prevention program. Lots of organization is using it with their dietitian, and people had some significant result using, but just want to tell you that this program exists now for over 20 years. And if you look at the bottom, this comes from a research that was published in the New England Journal of Medicine. And when you look at the result, it's pretty obvious that the lifestyle changes, including some of the element of the pillar that I mentioned earlier, give results that are better than the usual medication that we use for diabetes, metformin, and obviously a lot better than the placebo. So this is where it came from. And we know that lifestyle may have some significant impact in many other diseases, because the root cause of most of chronic disease are all the same. They're all related to lifestyle. And you change it, not only do you help the diabetes, but you help cardiovascular disease. You reduce high blood pressure. People tend to lose weight without counting their calories, because they're eating the proper amount of calories. And also just make sure you understand that there's sufficient amount of protein on the plant-based diet. So here's one thing I want you to know: that the Lifestyle Heart Trial is actually the biggest study that was done to prove it's a double-blind study. And I want you to remember, and maybe most of you have seen that name, Dr. Dean Ornish. It's basically the father of lifestyle medicine. So this physician who now has the clinic, the prevention clinic in San Francisco and San Diego, basically what they did, they took individual, and actually they did a quantitative coronary arteriography pre and post. I mean, these individuals are amazing to accept to go through this. But the experimental group, the green one, were under a complete lifestyle intervention, which is basically what I mentioned, you know, a whole plant-based diet. There was less than 10% of what they were eating were fat. They had movement, exercise, and stress control. And after a year, they realized that there was already a little bit of a change, and therefore decided to continue the study for 5 years and then see the significant change regarding the stenosis improvement and actually improvement into the clinic regarding angina. And despite of the control group being on medication for cholesterol, the experimental group were only on lifestyle changes. So it is possible that if they were on medication as well, they would have had better results. So this is where everything started as lifestyle in many, many years. And that's why I present this early study, because Dean Ornish continued working with the Center of Medicaid and Medicare to get his program accepted so that it would be paid, a paid program. It took him 60 years so that this program of lifestyle, intensive lifestyle changes would be accepted and paid, and it is. And this represents a 72 hours program, which is usually 4 hours a week, where people basically are taught the importance of plant-based diet, some psychological support, exercise, and many healthcare organizations are using his program. So if you want to even just check Ornish, Dean Ornish, you'll be able to see that the program is there and extremely successful. Another person who was excessively known and part of these pioneers is Caldwell Esselstyn, and is part of the Wellness Institute of Cleveland Clinic. He hadn't done many studies to demonstrate the importance of a plant-based diet with some exercise, like I mentioned. And as you can see on the right side, there was some pretty significant improvement during the 4 years of follow-up. 99.4% of the participants who stick to the whole plant-based diet avoid any major cardiac event. That is significant, including heart attack. Angina improved by 93%, and some of the non-adherent participants had experienced adverse event. So I'm going to show you a little video in the next one in order for you to see a little bit what Caldwell Esselstyn saw. When he presented, Dr. Esselstyn is in mid-80s, so sometimes his voice may be a little bit shaky, but here we go. It's about 5 minutes.
Anyone that has made even the briefest foray into nutrition here on YouTube is likely to have come across this famous picture from Dr. Esselstyn's paper, A Way to Reverse Coronary Artery Disease, and for good reason. It shows a startling reversal of coronary atherosclerosis not even distantly rivaled by any other treatment, but achievable with whole foods, plant-based nutrition. So unsurprisingly, advocates of the diet like to show it off. But not many people actually know anything about the story behind these famous angiograms. So why not hear the story from Dr. Esselstyn himself? This clip I'm about to show was taken from a video on the channel The Real Truth About Health, on which Dr. Esselstyn regularly features with some other inspiring talks and interviews like this. I'll leave a link to the channel and original video in the description box in case you're interested. Enjoy the clip, guys.
Now this is a surgical colleague, friend of mine. This is Joe Crow. In 1996, Dr. Crow began to get chest pain. So cardiology worked him up and could find nothing in October of 96. And Joe had a cholesterol of 156. He was not diabetic. He was not hypertensive, did not have a strong family history. He was not overweight. He exercised regularly. So 4 weeks later, November of 1996, he finished his surgical schedule and he sat down to write postoperative orders. The elephant suddenly sitting on his chest, pain in his left jaw, shoulder, arm, having a heart attack. Whip down to the cath lab, start the catheterization, cardiac arrest, resuscitate, finish the catheterization, one more cardiac arrest, resuscitate. Then he's sent up to the floors where he stabilizes and he's discharged 3 days later, but very depressed. He was depressed, why? He was depressed because at the time of the angiogram, they were able to find that the entire lower 1/3 of his left anterior descending coronary artery, the widowmaker, was all moth-eaten and diseased over this segment. And you cannot just ram in and jam in stent after stent after stent. And it was too far down the artery to have a bypass. So Joe was very depressed. So Ann and I had Joe and his wife out for dinner 2 weeks after his heart attack. Joe, come on. You've been eating this typical Western diet. You've got the typical Western disease. Why don't you think about going plant-based? We've got 10 years of data. Okay, yes, I'll give it a shot. But I'm not taking any of those statin drugs. I don't trust them. Too many side effects. Hey, not a problem. That's your call. He became the absolute personification of commitment to plant-based nutrition. And over the next 30 months, his total cholesterol plummeted. His LDL went from 98 to 38. And then he had another angiogram. Now, up in the surgical suites, my office was 3 doors away from his. So at noontime, I went over to his office, opened the door, and there he was, sitting behind his desk. I said, Joe, I understand you had the follow-up angiogram earlier this morning. You mind sharing with me? How did it go? He said, well, he came around, put his arms around me, a couple of these. He said, I think we're doing okay. I said, well, would there be any chance that I could see the angiogram? Yes. Now, what really, this is not going to happen to everybody. But when the plaque is young and soft and made up of inflammation, fat, and cholesterol, the body can do a remarkable job of reconstituting itself. When the plaque has been there for decades and it's filled up with scar and fibrosis and calcification, you're probably not going to budget much. Maybe a little remodeling. You'll certainly help the vessel wall around it. But it's going to be my job today to make sure that you understand that even those patients where you will not see this type of graphic reversal, even those patients are going to reverse their disease in a manner where they can return to full activities of daily living without restriction. And we'll get to that in a few moments.
So there you have it, guys. The lovely little story behind these famous angiograms, and a reminder that behind all the data, tables, epidemiology, and randomized control trials, there are thousands of people with amazing stories like this. Hope you enjoyed the...
So this is the, we'll make it happen. So this is the kind of story, this is pretty amazing. This is what I discovered myself 10 years ago. I had this conference, 3 days of these kind of presentation. And me as a physician, and maybe I'm not an internist, a family practitioner like you, but I was fully unaware of these results. And I've continued educating myself and pretty amazed to see how much we can improve the health of our patient by simply being able to change their lifestyle. So here's another study, the Adventist Health Study, which has almost 60,000 patients. just to demonstrate to you the impact of different diet, going from the non-vegetarian, which is mainly the North American maybe diet, to the vegan diet, where you see on the left, the body mass index, but probably the most important thing, the impact on type 2 diabetes, which is becoming the big danger issue, problematic of what we see nowadays, because there is quite a bit of patients that first are not screened for diabetes, but pre-diabetes is rampant, and we need to be able to assist these patients, and they would be the one that would be so easy to change their diet and change these numbers. This one is what I call the community-based intervention. So what happened when Finland went on the diet? This is pretty interesting. So after the Second World War, Finland was provided with land, animals, pork, and lots of butter and cream, milk, and they suddenly start seeing quite a bit of young men dying of heart attacks. So the name you see at Pekka Puska was a young physician at the time, and the government asked him just to go out there and figure out what needs to be done. And this is the work that he had done. Actually, Puska became the healthcare at the organization many years after and won some prizes. So he went in the community and, helped them to change from butter to other element, and taught women how to cook differently, had an impact on politics, policies, the business, went all around to try to teach and said, we need to change what we're doing. And the results were quite amazing. So first, just as an example, this is the consumption of butter per capita in Finland. So from the 50s to 2005, there was a substantial decrease in the consumption. And here's what happened with the result. The mean cholesterol in men aged from 30 to 59 plummet by making those changes. And most of the population didn't even know what change was happening, but these changes are significant. And then the mortality per 100,000. So the study was started in North Carolina. That's the start of the project. And then there was an extension to the project nationally. To tell you the truth, there's some TV program, almost like Netflix, where people in Finland were watching to learn how to make these changes. So therefore, it was not just the individual like you and I see in the office and trying to tell them what to do, and then they're going back in the community when nothing changed. This was all the community, and that makes such a significant difference. So I want to make sure you see that as well. This what we were doing when we start Rise Vermont in 2013. So here we go. Lifestyle change is probably the first line of defense that we suggest when you look at the American Cancer Society, the American Heart Association, the American Diabetes Association. But where do we start? If you say it to your patient, you need to change your diet, you need to exercise a little bit more. But I have to admit that as physicians, we don't know much about exercise and diet. We tend to realize and say, go and see a dietitian. And it is very important that we know better so we feel confident about what we're saying about a lifestyle. So what is it in practice? So I'm talking about some element that I've used myself, but I had my own practice because I went to the American College of Lifestyle Medicine. I was more confident talking about the plant-based diet. I was comfortable with the exercise because I'm an exercise physiologist. So it was not too complicated for me. The interest of the Complete Health Improvement Programs is that it's an evidence-based program. Many publications that have demonstrated this program, changing lifestyle. This is basically a 12-week program with video in group that lasts about an hour, where there's some teaching about chronic condition, teaching about food as medicine, and people are together and also discuss, how they can do changes. So I did about 12 of these programs in my community. By the time that, before COVID and Zoom, but now they are offering this program through Zoom. Another program that I really like, this one, I like it because it's a 2 weeks program. And I've used it quite a bit in my patient, in my actual practice, especially people that already starting to have diabetes or want to reverse diabetes or have, high cholesterol. The interesting thing is that this program is on Zoom. It's a 2-week program. The people are tested before and after, lots of teaching regarding chronic disease and plant-based, and also people learning food as medicine. And the interesting thing is that the physician that started that took a group of physicians to start, not patient, group of physicians, demonstrate to them the result. And then these same physicians took some of their patients and did the program together. The evolution of this program is that it's an evidence-based program. It's medically facilitated because they have a physician, obviously, on that always is present. They say assistant style because it's a very low-fat plant-based. So 2 weeks, most people are able to at least do those 2 weeks. It's via Zoom. There's a prep call, demonstrate the result. There's cooking demo. I did the program so I could see what my patient would have to go through. It's excellent. It is certified also by the American College of Lifestyle Medicine. The results is amazing. They are offering this program now at a price of about $100. I think it's now increased to $299. It's actually pretty cheap when you think that the result that they can obtain, and it's a 2 weeks program. Here's the result. They had about on these 1,000 participants. So if you look, you'll see 2 weeks. If you look at the weight loss, the systolic blood pressure, the cholesterol, the LDL, obviously they have even more. So this is a program that, like I said, I use. I'll be happy to give you reference regarding if you have any interested. But it just shows you that by using this amazing type of lifestyle changes, what you can have for result. And the interesting thing is that if you say that you don't want to become a lifestyle physician, at least you can learn about what is available out there for some of you patients that may ask a question and say, I'd like to be able to make those changes. So what does exist regarding education? I will say that it's minimal. There's only 27% of US medical schools that provide the minimum 24 hours of nutrition teaching that is recommended by the National Academy of Science. There is now a lot of College of Medicine that are offering lifestyle medicine, like food as medicine. The American College of Lifestyle Medicine is offering these teaching free. The curriculum is free and offered to anybody that wants to use it. If you look at, as an example, pediatric intern, they only answered 51.2% of basic nutrition knowledge, and primary care residency have minimal or knowledge regarding obesity. So it is time to have a little bit, and we're here to support you in order to have better understanding of lifestyle. Just to show you that the American College of Lifestyle Medicine had build up lots of information, the provider competencies, so that we can have a board certification regarding this new college. And if we were, maybe 500 when I started 10 years ago, there are about 10,000 people that are now member of the American College. The conference has grown substantially, and it's quite interesting to see how many people are there. So here's some of the element that I was talking about. So this, and if you scan this on the right side, this journal is a supplement for the family practitioner and lifestyle. This is a combination with the American College, AMA, Medical Association, that gives you an amazing supplement that you can read. It is available online. So there's introduction, the case of lifestyle medicine, talk about the pillar and what you can do with chronic disease. So lots of great information, and this is provided by the Edmund Institute of Health that is giving and helping you to have more information regarding lifestyle medicine. The other element that I mentioned earlier is this amazing conference at the White House. And again, you can scan the information that will allow you to have a reference to the American College of Lifestyle Medicine so that you can have this complimentary 5.5 hours of CME in lifestyle medicine, as well as food as medicine. It's not written here, but like I mentioned to you, there's a $2.1 million offer to healthcare provider of the FQHC in order to, in grant associated for at least some of you to have the chance. I think it's to have the chance to obtain your board certification in lifestyle medicine. The next conference will be in Denver in, I believe, October 23. So here we go. So I think the important thing now, I hope that I give you sufficient message to know that you can have some excellent education to start your journey in lifestyle medicine. Hopefully some of you will have the interest to potentially become board certified. You need some champion. There is no one any better than the healthcare provider to assist your patient. And you have all the reference there to communicate with the ACLM. You also have my own reference with my email address. So I'll be happy to answer any question. And if you need to communicate with me, then you have my email and we can make sure that I can help you with any question.
Wonderful. So if you have any questions, you can use the Q&A box, or you can I'll use the raise hand feature and speak directly with Dr. Fontaine. There's a few comments. So the first one is, you listed cancer as one of 15 chronic diseases influenced by lifestyle. I thought that the majority of cancer was either environmental or genetically based.
No, actually, it's amazing. And this is such a good question. I was as surprised as the person who's asking the question to see some of the amazing result related with in substantial decrease of some cancer. And Ornish had made some amazing study on the prostate cancer. But, you know, if you look at any type of cancer, colon cancer, breast cancer, you'll be amazed to see the importance of lifestyle. And I do believe into the literature that I send, there's a good chapter that will talk about the cancer. So yes, it's not only environmental, it is related to our lifestyle. A lot.
Okay. Joanne just asked a quick question. Yes, Joanne, you will be able to access this talk. It'll be recorded. It is being recorded. It'll be posted on our MAVEN Project website within, I would say, the next 2 weeks. So you'll be able to go through the clinic portal and access it that way. And tomorrow you'll receive an email with the slide deck and also the link to the CME survey. Okay. What is your opinion on Beyond Beef or other meat substitutes? Is it comparable to eating beans and vegetables, or inferior or superior due to it being processed food?
Yeah, I have to admit that obviously the food industry realized that we were changing our diet, and they came up with a lot of processed food, plant-based, quote unquote. So personally, I would prefer to see my patient eating adequate meat than eating in small amount of meat or fish, then go all the way in Beyond Meat. So personally, I mean, it's better than nothing. There's some started, but a lot of what is produced now is really fast food, plant-based. So we express to encourage people to do a whole plant-based diet coming from the ground, not the Beyond Meat. So that's what I meant too.
Is there any evidence regarding health differences between eating red meat versus poultry versus fish versus all plants or no meat?
Yeah, I mean, you know, I suppose that there's definitely some specific studies. I cannot tell on the top of my head. And people needs to be careful. I mean, we don't want to be too specific. And I have a lot of my patient are like that. If I do cut or if I take that particular supplement, it's really an idea of it changing the whole, and it's an ensemble. You need to, being very careful of, especially with the diet, to put as much color into your diet, as opposed to say, well, I'm not going to eat bread and I'm going to do, just be a whole amazing, colorful, plant-based diet makes the big difference. But I know that there's probably some studies that were done. I wouldn't be able to tell you on the top of my head for these.
Can you please comment of the role of excessive carbohydrate consumption in the American diet and the epidemic of obesity?
Well, it does have a substantial impact. Obviously, we all know that the fast food or the sugary beverage has a significant impact, and that we eat a lot more carbs than we used to. The thing also in plant-based, and people will say, but that's all carbs, but these are definitely different. They're not food processed carbs. They're the natural carbs that you find in vegetable and fruits. So yes, it's absolute that there's an impact. There's many element that has impact on obesity, but the strong amount of fat food, processed carbs has a significant impact on the obesity. I agree.
And just a reminder, I know we have another comment. I agree, the slides were excellent. You will receive them tomorrow in an email. It should come from Zoom.
That's nice.
It appears difficult to have a full plant-based diet and getting adequate protein without high calories and carbohydrates. Any suggestions?
Well, surprisingly, I encourage people. There's a good element in Netflix that will kind of show you the evidence that we can have some easily the amount of protein that we're looking for in the plant-based diet. The Game Changer, I was trying to find the name. So the Game Changer on Netflix, a good example of individual that does a lot of exercise, that champion in their sports. I'll give you an example, Serena Williams has a plant-based diet and has definitely strong muscle mass. So the thing is that you have to be able, obviously, to know more what does whole plant-based diet consist, and being able to realize the good combination of legumes, nuts, fiber, so that you can, come up with the same amount of protein. It is not as difficult as you think. There is plenty of protein in the plant-based diet. So I encourage you, check that Netflix. You'll be amazed to see people that are athletes that are consuming a whole plant-based diet. That's usually what I tell my patient. I said, just go and have a peek. You'll be amazed to see the result.
Wonderful. I don't see any questions right now, but we will pause and wait. Just a reminder, if you think of a great question or in your practice you think you could really use a little tip or an idea, you can always reach out to Dr. Fontaine on our VC platform. So we have a few more questions, and I do see Dr. Zemmel's hand raised. So Dr. Zemmel, I will unmute you in a minute. Well, let's do this question first. As we learn more about the power of insulin and the insulin response to processed foods and artificial sweeteners, I would expect your results of LM to demonstrate a decreased insulin response. Is there a proposed mechanism for the improvements? I still see a lot of vegan vegetarians with obesity.
Yeah, I think a good question. Thank you. The problem with vegan with obesity is, like we talked a little bit earlier, the majority of people that are quote unquote are vegan are usually not whole plant-based diet. They usually use a lot of fast food. That's why we have a tendency to call them vegan as opposed to whole plant-based diets. So these could be taking the margarine, thinking that this is plant-based, and they eat a lot of oils, a lot of bread, or so that's one of the issue. When you're a whole plant-based diet, you can usually eat as much as you can, and then definitely losing weight. So that's the distinction. People have problem to really realize what is a whole plant-based diet. They tend to be influenced quite a bit by the food industry. As far as the insulin resistance, you learn more and more that what's causing the insulin resistance is not so much the carbs, but the fat that we eat that makes us insulin resistant. And because we're insulin resistant, then we're not able to carry the carbs or the glucose that are in our blood, and then the glucose is elevating. I encourage you to read a book that actually was written by two individuals that are diabetes. It's called Mastering Diabetes. It's very interesting. Even as a physician, I was extremely surprised. And they have a website which is very helpful also for some of you patients that has in diabetes. And this is where basically I really learned about the insulin resistance in connection to fat meat. So I encourage you to look at this.
Does a plant-based diet imply complete avoidance of all meats and fish? Excellent presentation.
Well, if you're on the whole plant-based diet, it would exclude all of what you just mentioned. So, I want to make a little distinction here. If I have patients coming to me that are not too, I have one chronic disease, a little bit unhealthy, I encourage them to be more of, pro plant-based, forward plant-based, which is not eliminating everything. On the other hand, the other side of it is that if I was to see somebody that has a very advanced cardiac disease, it's usually not me that see this patient. Well, these will probably be under a very strict whole plant-based diet, like the assistant, you see, so that you can have results. So when you say the more you climb up in your unhealthy condition, the whole plant-based is even more important in how strict you want to be. But for me, as a general practitioner, OB/GYN, I tend to see average people that are, maybe starting to have one chronic disease or obesity, then we, progressively help them to change.
Okay, Dr. Zemmel has his hand raised. Dr. Zemmel, I did give you the ability to unmute yourself. Go ahead.
Yeah, thanks, Kristen. So this is a comment about functional medicine, which you listed along with integrative medicine, et cetera. And you were very kind and generous about the term functional medicine. But my experiences have been negative with practitioners of that class, including a personal experience when my oldest son, posted a short video on Instagram of him swallowing 25 pills at one time. So he was sort of showing off his amazing swallowing skills. And then later I asked him, why are you taking 25 pills? You're healthy. And he said, well, these were prescribed by my functional medicine provider, not a physician, but a provider. And in my own work as a rheumatologist, I found that a lot of my patients would seek out these alternative providers and functional medicine people were often naturopaths who were using interventions that were not evidence-based and ordered these bizarre lab studies, including my son, dozens of different lab studies searching for something to treat. So I would suggest to you, Elisabeth, is that when you're talking about things like functional medicine, you certainly have my permission to do it with a more critical view.
That's very nice. I appreciate your comment totally. I have to admit, first of all, in any specialty, as you probably know, Lawrence, I guess, there's always some good people and some other that may not be as good. In functional medicine, I had some very good physician that I know, and you could have some other that has a tendency to overuse the supplement. And I will say that in my education toward lifestyle medicine, this is what kind of blocked me from, and I'm not talking about functional, but general. I was a part of the learning and I was a little bit against using too many of a supplement. And I wanted to have something a little bit more optimal. So that's why I choose the lifestyle medicine. But on the other hand, I want to be careful. Some of the functional medicine physicians that I know are excellent. Just need to be careful. Obviously, it seems that your son didn't get the best experience, and I certainly do not recommend what you just mentioned. So thank you very much for your comments. It's very important, even in lifestyle medicine and even in regular medicine. We have people that may not be talking the right way. Same thing in rheumatology. So I appreciate your input.
We have a few more questions. Do you have any tips or ideas how a busy clinician or family practitioner or internist could find the time to educate their patients about the lifestyle changes?
Well, that's the reason why. First of all, having the chance to get some CME, fantastic. You need it. They're free. You want to learn, go for it. Yes, it takes time to be able to, support your patient. So in my practice, what I did eventually is to train myself, health coach, because I'm a coach. So I had some health coach with me. I had a dietitian with me so that we were able to work together. So usually in the FQHC, sometimes I'm hoping, I'm not totally sure that you have a dietitian available, and they could become lifestyle medicine board certified as well. So they could be very helpful. It's a lot of work, but this is why I'm here to talk to you. The more we help more physicians, more healthcare to know about, the more things will change. So I want physician to know, then, well, and I'm working with physician now. I'm coaching physician because the biggest resistance people were the physician. I wanted to make sure they understand the importance of being involved and helping the culture to change in the community. So thank you for that great question.
Is there any discussion with those who write the guidelines for the ADA and AHA diets regarding the differences between those diets and the whole food plant-based diet?
Well, there's a lot of discussion and lots of pressure from the food industry regarding being able, the recommendation of the nutrition to go forward with a whole plant-based diet. They're mentioning it more and more. And I don't know if you've read the very last one. It's a Bible of 1,000 pages. But I've seen quite a bit of the American College Lifestyle Medicine influence to try to make sure that we mention the importance of the diet as opposed to hiding and being pressed by the lobbying of food industry. This is political. And we have to go with what's available and continue working at it. So that's why it took so much time for lifestyle to be a recognized science and medicine.
The cost to a plant-based diet is often a roadblock that our patients in an FQHC may encounter. Are there any references or suggestions you may have to help assist in discussions with patients?
Yeah, well, first of all, it's amazing to realize that the meat nowadays is so expensive that you can have a pretty good meal on the plant-based diet. And you have to go with the season. Some season you have plenty of access to garden. And if not, then, frozen vegetable and then the beans that, you can cook yourself are much cheaper than buying meats. But there is also a reference, and I forgot to mention that the American College of Lifestyle Medicine has an excellent website with lots of information. And there is some information that compare very nicely the plant-based versus the typical American diet, and see how you can being able to live pretty good on a very small budget on a plant-based. So that's a very good question.
Could not unmute myself for a second. Are you aware if Kaiser or other HMOs are implementing lifestyle medicine strategies on a systematic basis for their patients?
Yes, Kaiser Permanente is actually, as the forgot to mention that I had in my presentation somewhere, I wanted to say Kaiser is such ahead of the game regarding plant-based. There's lots of their physicians that had written some excellent piece of article regarding a whole plant-based diet. So just want to give a salute to this amazing organization that has been able to get the message out there. So yes, absolutely.
Why do you think evolution would start our lives with a 100% dairy diet and then move to non-dairy?
I'm not sure I understand. Our life start with a dairy and now we're non-dairy. I'm not sure.
Well, I
And
think evolution-wise, we start.
I think evolution-wise, we start with meat, but at the time we were,
Nope.
you know, without
Nope. Okay. Let me read it one more time. Why do you think evolution would start our lives with a 100% dairy diet and then move to no dairy?
You know, I guess I don't think we tend to think that this was that way. If you look like the time of our origin, there was a lot of plant-based at the time. And I think also that the involvement of changing what our animals are consuming makes it a direct impact on what we're eating now. So, you know, I'm not quite sure that our origin was totally dairy, but I think that there was quite a bit of plant-based as well, as they were eating meat, but the meat is totally different than what we're eating now. And if you look at something like the blue zone, most of you might be more familiar with blue zone, these small area on the planet that had succeed to live up to 100. They are mostly plant-based, but they do have a little bit of meat in what they eat, and seems that they're successful in their longevity. So to what extent do we want to be totally extreme and remove everything? We just need to be careful. However, there is some pretty significant studies demonstrating the impact of our dairy consumption in increasing, cancer. Actually, I encourage you to read the China study from T. Colin Campbell. It's pretty amazing study that makes that correlation with cancer.
John, if we did not answer your question, just let me know. And
I'm not sure that I got it perfect on that one. I didn't understand totally the question.
That's fair. All right, I don't see any other questions, but we'll wait. Just a reminder that you can ask Dr. Fontaine all of your questions after the fact through VC. You will receive tomorrow in an email the slide deck, the CME survey, and in about 2 weeks on the clinic portal, you will have access to this recording. Also, the CME survey will appear when you close out of this webinar in a tab on your browser. But I think that is it. I don't see any more questions coming in. So Dr. Fontaine, thank you so much. This was really wonderful. I really enjoyed it. I think it was the perfect way to kick off the new year.
Yes, well, thank you very much. And I'm amazed all the questions people asked. This was fun. So have a happy new year. 2023 is for lifestyle. So
Right. Thank you, everyone.